Hi everybody, how are we doing here? Doing okay, Jordan?
I'm doing well, thank you.
Well, I'm Dr. Malhotra and I am an internist in Florida, in Spring Hill, and I have been involved with a lot of community efforts in order to prevent COVID-19 amongst healthcare workers, daycare workers, grocery workers, etc., people who have high exposure. And this here is,
My name is Jordan. I'm a third year medical student.
and this here is,
Dianelis Pinto, I'm a nurse practitioner and a lot of experience with COVID too in Spring Hill area.
So we are here to talk about how to keep our children safe in a daycare. And I think it is very important that we realize that these children are really, really young, and it is very difficult to give them a directive and a disciplined way that we can direct adults in. And in order to keep them safe, we feel that the best way to do it is to keep those who are around them safe against COVID, and that's the way to not introduce it into this population of young children, because now with the variants that are coming, we see that the children are also being affected badly. So I think some of the very, very important aspects of protecting people around the children is, number one, is vaccinations. We know that vaccinations are highly effective, and therefore people who are around these children who are not yet eligible even to get the vaccine, these people should be vaccinated in order to keep the kids safe. Then of course, masks. We know that there are a good chunk of masks, different types of masks. For instance, I am wearing what is called an N95 mask. What she's wearing is a KN95 mask. You will see many people wearing what is a surgical mask. There are some people who are wearing cloth masks, and we know that the two of us are wearing the most effective masks against this. Then comes the other standard, which is slightly lower because it doesn't have as good a seal as you might notice on top of the nose. And fortunately, we are all vaccinated. This is a surgical mask, and it doesn't really protect you much, but it protects others because it doesn't give the whole blowout of all your breath coming out of your nose into a full, a fluffy area of air where the virus can be caught. So since we're all vaccinated and we are sitting in this indoors, outdoors, of course, we would not be wearing these masks. But indoors, we are wearing these masks just to say that this is how we try and protect ourselves in dangerous environments, in company that we know may not be vaccinated. But amongst us vaccinated individuals, we usually do not mask up. So I'm going to take my mask off. If you're comfortable, you take yours off. If you're not comfortable, you keep it on. It's not that you have to be forced into the herd behavior of doing this, that I have to take my mask off. You are entitled to as much protection as you choose to as yourself. Just like our gun laws allow you protection, I think our masking options should allow you protection. Okay, this is my option. I want to pick this mask or that mask, knowing that these are some of the less effective masks and the ones that we were wearing are some of the better effective masks. The cost obviously changes slightly with each type because this is the least expensive mask. And then of course, this one is typically the most expensive mask, the N95. In order to keep our children safe in the daycare, I think the daycare workers should be immunized. And if they're not immunized, they should practice the highest form of protection, which is an N95 mask religiously being worn. There, of course, the daycare owners can take some steps, like we were talking earlier, that they could improve the ventilation systems and have high-grade filters like we have in our office. And when we had our office, we had a negative pressure room, but there were times when we would take the filtered air and pump it back into the air conditioner. But coming to vaccines, we've all seen that people are very hesitant to take vaccines. And I would like to address that and get your opinions as well. I know that, some people think that vaccines are just not effective. What is your opinion on that, Jordan? You just had a nice rotation at the hospital for 30 days with an infection specialist. Is that right?
Yep.
Okay. What did you see?
I mean, obviously with an infectious disease, I saw a lot of COVID in the hospitals. Every single one of the patients that I saw was unvaccinated. And these weren't just like...
Every single one?
Every single one, except for one. There was one patient who was admitted to the hospital because his fever was too high. They just wanted to watch it, make sure it didn't progress, but they discharged him the next day. So, with that being said, it was very clear to me how effective the vaccine was because I saw the havoc that it wreaked on all the people that were not vaccinated.
So in the intensive care units, did you see people who had the life support systems on?
All of them, yeah.
All unvaccinated?
Yep.
100% of them?
I mean, I can't say with
But with whosoever
in
you
that-
attended to,
Right, with the ones I saw, yes.
all unvaccinated.
Right.
So, we know that this is a very, very difficult topic to address because some people have closed their minds. Some people who are still open-minded about things are just seeking more information.
Sure.
And they want to see that, is this a conspiracy? And what would you think about that? Could this be a conspiracy? I know you're a medical student, you have nothing to gain from this.
Right.
I'm a physician, I build things, I build for vaccines, I build for administration, I have money to gain from it, but you yourself have nothing to gain from it.
Sure.
What would you say about that?
I mean, like we discussed, I think that with this conversation about conspiracy, my biggest thing is to ask what is the possible gain that they could have from this conspiracy theory. So there's people that are worrying about microchips, and obviously we can discount that for various reasons, but people are constantly being tracked and listened to with their various devices, so we can negate that already.
Yes, because there's enough access that they have to us, regardless of what else they do.
Sure.
Yes.
And so I can't, if you can give me a solid argument as to what gain they could have from this conspiracy, then I may be more likely to engage in that conversation.
Yes. Now, people who have developed the vaccines themselves have taken the vaccines.
Right.
Do you think that they would be willing to decapitate themselves?
Right. Cut your head off to spite your face.
That's right.
I think you put it very well when you talk about trust.
Yes.
So
I think people have to trust somebody, a professional that they have trusted for a long time, built a relationship with, and get some advice and be able to discuss their concerns about the vaccine.
yeah.
But we also talked about the FDA being unreliable, but if you take even a single medicine that is in the United States, it's FDA approved. So if you take even one pill for any disease, you are already being protected by the standards of the FDA that disallows so many of the spurious medications from entering our country. So it definitely is one of the most strict organizations in terms of standards, and it never gave full approval to the vaccine until there were hundreds of millions of doses already given out, their efficacy tested, and their side effects monitored. Would you agree with that?
Right. If I'm correct me if I'm wrong, but I also believe that the only one vaccine has been FDA approved.
Correct. Only one has been approved.
Right.
So because that had started to be used so much more worldwide, that lots of doses had been given in Israel, in Britain, in other countries, the US, that we had enough data on the Pfizer vaccine that it got FDA approval. But right now, there are people who are not sure which vaccine to take, even though one is FDA approved. So, we've been discussing this in our office itself, that when we advise patients that should we go for the FDA approved vaccine? Not necessarily. Currently, we are still using or preferring the Moderna vaccine.
Right.
Yeah, because it has almost double the efficacy of that of the Pfizer vaccine and other vaccines in terms of the Delta variant, which is the most prevalent variant at this point in time.
Right. And that very well could change, right? I mean,
yes,
we know that the Moderna happens to be the most effective against this particular variant.
So now,
right.
Yes, so our information may change. Doesn't mean that we are wrong now. We might be proven wrong later, but we can only give you what is most current.
Sure.
And we want that to be transparent to everybody so that they can actually trust the system in saying that, okay, this is, that if they change their mind or their verdict, it is simply because we are getting more information, getting more knowledge, and we might change our word later on. Because this is a relatively new disease that we are tackling. But there have been vaccines for ages on. We've eliminated so many diseases like smallpox. Hepatitis. We don't see hepatitis B in children anymore or in adults anymore who actually got the vaccine. We polio, tetanus. So people are concerned about what this particular vaccine contains. but most people would not be aware of what vaccines contain regardless. So let's say if I'm allergic to something, we were talking about this, that there is one chemical that is very important that we remember that is in these mRNA vaccines, and that is the prep for the
Colonoscopy.
preparation for colonoscopy.
Yeah.
So if you're allergic to the preparation for colonoscopy, now if you've had a colonoscopy, we all know it's very, very uncomfortable to take the prep. That's not an allergy, it's uncomfortable for everybody. But if you start to develop hives because of it, you cannot breathe because of it, is what we call an allergic reaction. And those are the guys who should first warn the doctor what's going on. And of course, we monitor patients right there on site as we give them the shot for about 15 minutes before we let them leave to make sure that they have not had an allergic reaction.
Yes.
Now, in terms of the mRNA technology, people are, little wary of that. What should we be able to tell them that this technology is? Can this change their DNA?
Right. Well, I think that you have to do research into biology and understand what an mRNA actually codes for and how it functions. Because when you're skeptical of something, it's okay to be skeptical of something that you don't understand, but then use the knowledge that we have. We have unlimited access to information. Look at how mRNA works in a particular cell and how the proteins are created, and then make a decision for yourself. Or you can talk to people who have taken thousands of hours of schooling to learn these things and to make these judgments and help you, guide you along with your medical knowledge.
Yes. So, people think that it can make them infertile.
Sure.
But would healthcare workers be taking it if this were the case? We ourselves, who have the most detailed knowledge and information about what's happening and how we monitor people, we would not be taking the vaccine. But healthcare workers have a 50% higher rate of vaccination compared to non-healthcare workers. So obviously there is a trend that we guys set in health, and it is very important that you trust healthcare workers for a healthcare problem and not a politician or a radio host for a healthcare problem. So there are some people who are waiting for the whole family, that when my whole family is convinced to take it, then I will take it. What would you say to those people?
Well, I think you put it very nicely, is that when you have a whole family that are hesitant to take the vaccine, somebody's going to have to jump in and take it and be the first one. Nobody wants to be the first one to take a cookie, right? But as soon as one person takes it, everybody starts taking them, right?
Yes, you're right. So somebody has to take the lead in the family and say, I'm going to learn more about it. I was once testing an oxygen chamber. And in an oxygen chamber, you could die if it's not functioning properly. And I did not want to put my wife in there. I went in there myself because somebody will have to take the lead in order to test it. I do not want to put a patient in there. I myself went in there, tested it out, made sure that it was working fine before I went in for somebody else. So we all have to be not just selfish, but selfless, and we are a mixed bag of both. I think it's very important that we think about those people who are anti-vaxxers, that I know that you're worried about yourself and you don't want to do things, but you have to realize that somebody else has vaccinated his children against mumps, rubella, tetanus, COVID, etc. And you, being an anti-vaxxer, are going to be one of the very few over there, but actually are enjoying the benefits of the entire society, helping to protect the entire society, so that we not just take from the society, but we actually give and contribute into a society as well.
Right.
What would you say to those people who say that this is big pharma getting into it? We know that Moderna is a small company, correct? And the government has funded a lot of small companies and not just big pharma in order to develop this vaccine. And I give full credit to President Trump, or our last President Trump, in making this happen. And I give great credit to President Biden as well to take with what has been developed by Mr. Trump's efforts and take it and bring it to the public. I think politically we are divided on many of these issues, and some people are still in a revolt mode. What would you say to those people who are in this revolt mode because the government has changed?
Well, like you said, with anti-vaccination in general, we have a community and we're here to help each other. And we talked about listening to traffic rules because it's continuously keeping everybody else safe.
Yes.
And so there's a reason why there's more measles in America now, more mumps in America now, because as people are making these scientific issues politicized, now you're starting to see a rise in these because that herd immunity that you were talking about before is starting to decrease.
Yes.
And so more and more people are getting sick with things that we've almost eradicated from the United States
Yes.
beforehand, and now they're coming back.
Totally. So I think a collective effort of every parent to protect their child, of every worker at a daycare, every healthcare worker, each one of us who is responsible for contributing care to others, it should be there in order to protect the entire community of those people who are being cared for.
Right.
Is that what you would think so?
Yes.
So what do you think about testing kids in the daycare? Obviously that's cost, like you had mentioned earlier, but a periodic testing might be something that more targeted to those people whose parents might not, those kids whose parents might not be well, and they could get the test done right there at the daycare, an immediate test, so that the sick child cannot enter the daycare and make more children sick, and can actually go home with their parents and get recover properly from the illness.
Yeah, that would be a good idea when the parent observe the kid had any symptom or any problem before they get into the daycare that day. They communicate to the staff so that they can do some testing on them and do the proper follow with them and prevent that they bring the sickness to the community daycare.
Yes. Now, the other day I was talking to a patient who did not want to get vaccinated, and I was stumped by his answer. He said, "I believe in God and God will protect me." What would you like to say to those people?
Yep. So I think that, if you believe in God so strongly, right, and everybody has their own beliefs, but when you believe in God that strongly, you believe that God created humans in His image or her image or whatever, right?
Yes.
And so I think that God has then given you the power to have these thoughts and question what's going on in the world around you. But it also gives everybody and the scientific community the mental fortitude to create something like this. And so we've used these tools, and we use tools all the time to help us survive. And I think that this is just another tool that we have been given to use against something that may kill us.
Totally. Well, I really appreciate the input from both of you, Danelis and Jordan. Thank you so much for helping create this little conversation in order to help people become more open-minded about protecting and coming together in their efforts in protecting the most vulnerable who currently cannot even be offered the vaccine.